On Saturday, the country woke up to the shock of the tragedy that befell residents of Kiteezi, Landfill.
On Tuesday, 13th August 2024, the Minister of State for Relief, Disaster Preparedness and Refugees, Honorable Lillian Aber, revealed that government is moving to decommission the Chesi landfill following its collapse.
Kampala capital city landfill at Kiteezi village, Masoli parish in Kasangati town council, Wakiso district, collapsed in the early morning hours of Saturday, August 10th, 2024. Affected villages including Lusanja, Chitetika and Kiteezi. Way forward, Right Honourable Speaker. Reduce the fill to manageable size and decommissioning the dam sides. We have 32 acres of land that has been identified at Memvu. 4 acres in Kiteezi, 14 in Nkumba, some of which is not suitable as alternative landfill sites, but they are under investigation and we'll wait for a report from KCCA because we were tasked to work together with them. Privately owned sites like in Chengera, Nabugabo, Abdil are also options we are looking at.
The witnesses are reporting that it was a blast that blew up the sand and garbage in the air with the smoke and then it came down covering people's houses. That's the narrative from the residents. They even continue to allege that for months they saw Chinese contractors installing pipes in the heap of garbage because there were 2 heaps. There's a new heap and the old heap. Now the old heap is the one where the Chinese installed alleged pipes. And when the locals questioned, these Chinese briefed them, according to the narrative from the village, the locals, that they are extracting gas.
Right Honourable Speaker and members, I've not seen any Chinese on site and I cannot comment on that. Those are just allegations.
In the sitting, Parliament rejected the Alcohol Control Bill 2023 that sought to regulate the purchase, sale and consumption of alcohol.
Alcohol has for a very long time been consumed in this country. And over time, the country has been grappling with the need to regulate the manufacture, the sale, consumption, and access of alcohol in the country. The 2 pieces of legislation that existed then, the Nguli Act, Cap 86, and the Liquor Act, Cap 93, did not adequately address the current challenges of the alcoholism in the country, such as the alcohol addiction, the domestic violence, the child abuse, and increase in mental impairment cases in the country. I want to move that the Alcoholic Drinks Control Bill be read for the second time.
Whereas it is necessary to regulate the manufacturer, importation, sale, consumption and advertisement of alcoholic drinks, the bill in its current form falls short of addressing the real challenges like illicit trade in alcoholic drinks, alcohol abuse, quality control, enforcement mechanisms, personal freedoms, economic impact and efficacy of such controls, among others in the alcohol industry. The challenge lies in finding the right balance that safeguards public health without unduly infringing on the economic rights and freedoms of individuals and government revenue. This being a private member's bill, the committee is constrained to consider the proposed amendments that have an effect of imposing a financial charge on the consolidated fund. The committee therefore recommends that this August House should not proceed on the motion for the second reading of the Alcoholic Drinks Control Bill 2023.
I strongly advise and pray that in order to avoid causing regulatory confusion, we wholly reject this bill, and then the good ideas that we have picked up here, we can find the necessary laws where they are supposed to be input.
I now put the question that the Alcoholic Drinks Control Bill 2023 be read the second time. Those in favor say aye and the contrary nay. The nays have it.
On Wednesday, 14th August 2024, members of Parliament put the Minister for Energy and Minerals Development, Honourable Ruth Nankabirwa, to task over pending connection of electricity transmission lines following her statement on the status of electricity connectivity and ongoing related projects in the country.
A total of 210 sub-county headquarters, town councils were electrified under the project, adding 3,202.46 kilometers of medium voltage and 6,827.82 kilometers of LV or low voltage to the national grid, as well as installation of 1,744 distribution transformers that were fully completed, commissioned, and handed over to the various network operators like Umeme, UEDCL, Kilembe Investment Limited, Wanareco, for operation and connection of customers.
Hundreds or probably thousands of kilometers of low voltage lines constructed by the Rural Electrification Agency, REA, had not been energized or commissioned. More than 3 years since these lines were erected, the lines are still not energized in many parts of the country.
The power supply is on and off, and it is a disturbance to the people of Kalangala, and especially the business community. Mr. Speaker, we are connected to the line from Villa Maria, which goes through Bukakata, the marine cable to Kalangala. This one is very congested, and we, through the Kalangala Infrastructure Services, request that we get a dedicated line for Kalangala.
The House also paid tribute to former Presidential Press Secretary Tamale Mirundi, who passed away on Tuesday evening.
Last night we lost one of the ardent media personalities in this country, Mr. Tamale Mirundi, at Kiteezi Hospital. He died last night. He served as a Presidential Press Secretary for 13 years and has served this country for long. I want to express my condolences and those of Parliament to his family, especially John Tamale, the son, who works with us here in the Legislative and Procedure Department of Parliament, and friends and the entire country on this request. May his soul rest in eternal peace. Let's observe a minute of silence in his honor.
May his soul rest in eternal peace.
On Thursday, 15th August 2024, the Minister for Health, Dr. Jane Ruth Aceng, assured Ugandans that the outbreak of monkeypox in the country is under control and being managed efficiently by her ministry.
Mpox transmission to humans is by contact with the infected animals. Among humans, it spreads by direct contact with an infected person. Mpox is a self-limiting disease presenting with pustules. Despite the self-limiting nature of Mpox, in a number of cases, the disease can be fatal. Treatment is symptomatic depending on the complaint, as there is no specific treatment for the virus. When Mpox re-emerged in the DRC, the Ministry of Health undertook a risk assessment in anticipation of potential importation of cases. A number of immediate steps have been taken to protect the population. Following the assessment, 23 districts were classified as high-risk districts, and these were the 17 districts bordering the DRC, 5 districts hosting refugees from DRC, and Kampala because of its highly mobile population due to trade and other reasons. This guided the development of a 1-year Mpox preparedness and response plan, an emergency response mechanism, that is the incident management system, consistent to what we used to respond to COVID-19 pandemic and the 2022 Ebola epidemic outbreak, has been activated at the Ministry of Health and in Kasese district. The ministry has since reached out to the US government in Uganda and the World Health Organization for vaccines so that we can prioritize the high-risk groups. Those are the health workers, their contacts, and other frontline workers, but also including the vulnerable ones that I previously highlighted. We are working with WHO to enhance cross-border collaboration among countries in the region for real-time information sharing and cross-border surveillance.
During the sitting, government lauded Team Uganda for its exceptional performance in the recently concluded Olympics that took place in France from 26th July to 11th August 2024, where Uganda emerged 55th out of 206 countries that participated in the sporting event.
Uganda celebrated its 12th and 13th medal in the 10,000 meters and 3,000 women's steeplechase final at the Paris Olympics 2024 Games that remain one of the golden moments for Uganda. Joshua Cheptegei reinstated himself as Uganda's greatest sportsman of all times, winning 10,000 gold medal and setting the new Olympic gold record, and he is now the world record holder with 26.43, 1.4 microseconds, and Perus Chemtai winning a silver medal, but also registered a personal best and a national record after crossing the line with 8.53.34. In our bid to motivate our athletes who won the gold medal, the Ministry of Education and Sports had already budgeted and planned to give a gold medalist 100 million shillings, a silver medalist 50 million shillings, and a bronze 30 million shillings. I want to confirm we are going to give this money to these individuals, the two who have won the medals.
Also in the sitting, the Deputy Speaker, Thomas Taewa, clarified on the new contract for the Parliament Canteen Service provider following concerns raised by Honourable Alioni Odria.
The contract of the previous contractor expired, and Parliament ran an advert. The contract buffet for members of Parliament, a plate together with the drink, has been at 13,983. This is a contract that had been running for many years. For staff, it has been at 10,000, and I have the documents here. And in fact, I had come with them because I thought I would meet Honorable Arion earlier on. I give him the documents, but he has now provoked it early. Now, a buffet for a member of Parliament now is at 21,000. Yes, I'm having the official documents of Parliament, a contract. And after over 10 years, and a buffet for staff is at 13,000, an increment of 3,000, which came out of a procurement process. House adjourned to Tuesday at 2 p.m.